Hello, welcome to Half Hour to Health. I'm Dr. Dietrich. We have an exciting show for you today. We're going to be talking about new and effective approaches to common health problems. We're going to be talking about such things as inflammatory conditions such as arthritis, cardiovascular problems, irritable bowel syndrome, and how about menopause and fatigue. I have people calling me and asking me questions about alternative therapies. They say they're sick and tired of taking medications that don't seem to be working, or they're having procedures done to them and not working. They're saying that their body's immune system is not functioning as well since they've had these procedures. My guest today is Dr. Beth McDougall. Dr. McDougall is an associate medical director at the San Francisco Medical Group. The San Francisco Medical Group has been around for around 26 years. It's one of the first clinics in the San Francisco area. It has an international reputation. They see patients from all over the world. Dr. McDougall, what a pleasure having you on the show today.
Thank you, Dr. Dietrich.
I want to first start out, Dr. McDougall, let's discuss a little bit about Western medicine versus alternative medicine. Could you elaborate just a little bit on that for me, please?
Sure. I will try. It's a big question.
Okay, I know it is.
I'd say the main differences between Western and alternative medicine are a matter of philosophical orientation and treatment approach.
Okay.
Western medical practitioners have found themselves dealing more with acute health situations. And because of that, and perhaps also because of time constraints, they tend to focus more on the symptoms of disease and using modalities to alleviate symptoms. So, for example, if someone came to them with an inflamed joint, they may use a painkiller or an anti-inflammatory.
All right.
Okay? The better alternative medical practitioners really try to get to the bottom of what's going on.
All right.
So whenever possible, they are asking the deeper questions of why might that person have an inflamed joint? Do they have an essential fatty acid deficiency? Or do they have food allergies? Or do they have some sort of systemic infection that's causing a localized inflammation in the joint? They would focus on trying to get to the bottom, healing the imbalances, and often then the symptoms will go away on their own.
Okay. Now, it seems like Western medicine is grounded in scientific research, and they say that alternative medicine is not grounded in scientific research. Can we talk a little bit about that for just a moment?
Absolutely. First of all, alternative medicine is researched quite a bit, but the research is usually presented in non-mainstream medical journals. So if someone is interested in looking at some of the research, you have to dig a little bit to find it. The second point is most of the research on Western medicine is funded by large pharmaceutical companies.
Interesting.
So research becomes kind of a political endeavor in a sense. The pharmaceutical companies have the money to fund large, double-blind, randomized, placebo-controlled studies, and they are willing to invest the financial output because they will come out with a patented medicine that they can market. Unfortunately, you can't patent a nutrient or an herb, and so there's no financial incentive to do these large studies.
Okay.
So usually the studies done on alternative medicine are smaller, but if you are willing to compile data from several smaller studies in a meta-analysis, let's say, you can find some useful information. So we need to look at new ways of studying alternative medicine.
Now, would you say if that alternative medicine had the funding that, say, Western medicine has, would there be a lot more, with more research there, would there be a lot more answers then?
I think so. And we're fortunate because the National Institutes of Health started a department of alternative medicine about 5 years ago, and now they are funding studies in alternative medicine. So things are changing.
Okay, give me some examples how you approach some of these problems that I have just mentioned. As an example, say like, let's talk about menopause just for a moment, okay? How would you approach menopause differently than, say, Western medicine does? Say, I know they use a lot of synthetic estrogen therapy. Is that correct?
That's right.
Okay, now how would your approach be different? Would it be more effective then, or
it seems to be very effective and cause few side effects.
Yeah, okay.
But what I do is I first sit down with a woman and spend at least an hour going over her health history, and we look at how symptomatic she is with menopause. Is she having hot flashes, vaginal dryness, mood imbalances, and how troublesome are these symptoms to her? And then we look at what her risk factors are for diseases that can potentially be prevented by hormones. Like, what are her risk factors for cardiovascular disease, for Alzheimer's, for osteoporosis? And then I ask, what are her risk factors for diseases that can be caused by hormones, like breast cancer, uterine cancer, and ovarian cancer? And so we take all of that information into account and really try to decide, do the risks of hormone supplementation outweigh the benefits? And in many cases, it actually, the risks do, in most cases, the benefits outweigh the risks.
Okay, interesting.
And so what we'll do is we'll often start with diet and lifestyle modification to see if that will alleviate some symptoms. And if we need to, we'll move on to using some herbal medicines. And from there, if we decide to use hormones, I am an advocate of natural hormones.
Very good. Very good.
Most women, when they go to see their Western medical practitioner, are prescribed Premarin or Provera.
Heard of them.
You've heard of them. Premarin is actually made from pregnant mare's urine. It's an estrogen, a combination estrogen supplement from pregnant horse's urine.
Wow.
And it has horse estrogens in it that our body has never seen before. And so often women will have side effects from that medicine. Provera is a synthetic progesterone. So the molecule is a little different than what our body usually makes, and so women will often have side effects from that. But I use natural hormones, and when I say natural, I mean hormones that are exactly the same structure as what our own bodies make.
Really interesting.
And so when you're supplementing the hormones that the body evolved with, you rarely have side effects. And then if a woman's blood levels of hormones are measured periodically, you can make sure that the dose you've chosen remains in the safe range, and you can minimize risks of hormone-caused diseases.
Okay, so in other words, by the alternative therapy towards these particular problems, these menopause problems, you're more or less adding to the body. You're giving to the body.
That's
instead of
right.
taking from the body. Does that make sense? Or?
Very much. And, you know, there's this new field of anti-aging or longevity medicine that's kind of evolving and becoming very popular. And what you're trying to do is just maintain youthful levels of hormones and different important nutrients.
Okay. It sounds to me that every woman should be checked in alternatively, because it's going to be, in the long run, it's going to be a lot better for their health then, instead of just being blindly saying you need to take some estrogen and that's it. I mean,
right, because not every woman needs to take it.
Okay.
Yeah.
Now let's talk a little bit about cardiovascular just for a moment, okay? I know there's a lot of people are concerned about cardiovascular problems out there, heart attacks, etc. Now, we hear a lot about bypass, people get triple bypasses, or just, you know, heart surgery in general. I hear a lot about people having heart surgery. So is there any other approach beside having heart surgery, or can we catch it before maybe it gets to that point, say by using alternative therapies, say in your practice?